Greetings to all of attendees, everyone who's jumped in on this amazing opportunity we have here today for our ACAM members, AAPMD. We're delighted to have you here. Today we have the special opportunity of hosting a collaborative webinar with the American Academy of Physiological Medicine and Dentistry and the American College for Advancement in Medicine. The format today will consist of a brief introduction from Dr. Hendon and Dr. McBride, followed by an interactive presentation by Dr. Gomanak with live commentary and interjections from both Dr. Hendon and Dr. McBride. And ultimately, it's going to be followed by a Q&A session open to all attendees. So throughout the presentation, if you have any questions, please post them to the right in the chat section, and they'll be answered at the appropriate time. So next, I'd like to introduce Dr. Hendon, a man who needs no introduction, but will receive one anyway, because
Let's just skip that.
All right, sir. It's on to you, and go ahead.
Hi, everybody. I'm Howie Hendon. I am the president of the AAPMD, and I'm joined tonight, so it's night on the East Coast anyway, by my co-host on the West Coast, Dr. Pat McBride. Hi, Pat.
Hi. And
our guest from the middle of the country, from Texas, Dr. Sasha Gomanak. And Jordan, if you'll put on the introductory slides that we had before, that'll be great.
Yes, sir. We are moving through those right here. Here we go.
And so for you who are familiar with our seminars we've been running, we're using a different platform tonight, and it's so great to have the production taking off our hands, and Jordan from A Meeting by Design, they've taken over putting this together, and it's the collaborative AAPMD ACAM presentation, because a number of years ago, ACAM and the AAPMD got together and we started this movement. First it was a conference, and it became a movement called Collaboration Cures, because the answer to all the ills of all these chronic problems we knew came from different practitioners collaborating together. Nothing is more apparent than this whole issue with COVID. Is it really a disease, or it seems to be two diseases? One disease that people don't even know they have, the other disease which very severe symptoms and even death. So a couple of weeks ago, as I was telling Dr. Gomanak, I was reading about that areas where there's low levels of vitamin D, people seem to have more severe symptoms and greater incidence of death from COVID. And then a couple of days ago, there was another article saying that too much vitamin D doesn't have any benefit, and it can even be bad. I immediately thought of Dr. Gomanak, because she's been very instrumental. Pat and I know her for years, and Pat's going to tell you about how she took her course, one of her first courses. And Dr. Gomanak talks about the right sleep and the right amount of vitamin D, and how it fluctuates. And we're going to talk about how you might need to take it on an ongoing basis in order to get your vitamin D just right. I always think of it as Goldilocks and the 3 vitamin Ds. And so I immediately said, we have to do a vitamin D webinar, and we have to get Dr. Gomanak back in order to do it. So Pat, if you just briefly share how you got involved with vitamin D and Dr. Gomanak.
Well, anybody who knows me knows I come out of the dental sleep medicine and respiratory medicine space. And back when, like 6-7 years ago now, easily, I was really looking at how all of these disparate pieces in the patients that were coming in on their medical histories, things just didn't fit together. And I realized that I needed to start looking at what they were doing nutritionally and going on, so on and so forth. And I just kind of landed on an article by Stasha and Walter Stumpf. It was like ancient literature about vitamin D. And I thought, well, I know this is pretty oldie but moldy, but let me see if I can find this lady. And so I dug her up. I just kept searching and searching. And then all of a sudden somebody said, oh, there's this video on YouTube for one of her lectures for in Texas. And so I watched it, and then I just kept bombarding her office saying, I've got to talk to her. I need to figure this out. And then she was just piloting, putting together this right sleep program, just bashing it around. And Mike Selleck and I flew down and we took her course. And it was like an epiphany. All of a sudden, this big piece, this big fat elephant that's been sitting in the room got a tutu. That we could actually look at it, we could move it around, we could see that for each individual it's different, and that what we need to do for each person needs to be very precise. And she was offering us a pathway that allowed us to do that and partner with their physicians in a really positive way. We actually took this piece off their plate that they don't really want to look at and added it onto our plate in the dental sleep medicine space, and actually changed the patients, how their overall homeostasis was. And so that's where I met her, and we've known each other a long time. And I can't tell you the hundreds and hundreds of patients that we have benefited from just looking at their vitamin D, taking her program. We refer them to all of her videos, because you may not have time to spend 45 minutes explaining this to them, but all they need to do is watch her stuff. And then they become part of her world. So it's huge.
And Jordan, could you put up the introductory slides, please? And that's
Whoops.
it. That's good.
They
All
can
right.
read the introduction. So the
Let
introduction
me go-
itself,
let me go-
you want to
let's
go through it?
Let's go through this first.
Yeah.
And we'll go back to the introduction. And the other thing I just want to add is that it doesn't matter what practitioner you are, physician, dentist, myofunctional therapist, physical therapist, vitamin D, you need to know about vitamin D. It's essential. And you may have a part of the vitamin D answer, and another practitioner has another part. So it is truly the vitamin that craves for collaboration. So we just wanted to share a couple of things about upcoming events, which we're really exciting about. Some of them are more AAPMD, some of them are ACAM AAPMD. Tomorrow night, dentists have sort of been relegated to the back of the reopening line, but we have 6 presenters tomorrow night talking about what you need to know about reopening your practice. And then on June 2nd, I'll let Pat tell you about that, because these are 2 of her favorite people.
These are 2 wonderful ladies from the speech and language pathology as well as myofunctional therapy space. Nicole Archambault is really known for her work with special needs children and her work in the space that nobody seems to want to occupy. How do we manifest changes and help children with needs like autism? How can we help them in our myofunctional therapy practice and or our speech and language pathology practices? And Linda D'Onofrio, who is an international speaker on speech and language pathology, and really somebody who believes in the science of it all and making sure that we have evidentiary support for everything that we do, feels very strongly about the fact that every therapy that we do, we have to strive to reach every level of our society. In other words, we have a means by which we can give therapy to our people when they can't afford to come into our practice, when they can't afford to do a package sort of deal. What can we do to help serve this patient who is in need but cannot financially afford our services? So both of them are speaking to the heart of what's most important, is how do we get what we do to the most people in most need. So it's going to be a wonderful blockbuster 2 hours we have planned for you there.
And I'll just mention the other 2 on June 3rd, because Pat was pushing me to get Avi to do another update.
Yeah.
Avi Herskowitz, the president of ACAM, who has done, I think, 3 updates about rate, and we open that up to both practitioners and the public. And he's great, and he has new news. He always has new things because he's always scours all the research. And then on June 10th, I'm going to let you talk about that, because that's one of your personal favorite, another one of your favorite people.
Right. So Dr. Heather Servati-Saib is the head of mental health and education at Purdue University. She's actually one of the professors that I researched under back in the day. And she's going to talk to us about perspectives. She's one of the creators of losses and gains theory. And how do we look at that with COVID? How do we look at the losses that each and every one of our patients and ourselves are feeling, and we turn that into gains as we move forward? That'll help us with being more flexible, more adaptive as individuals and as families and as providers in our community. So she has much to say, and it's going to be interactive, much like our webinar with Dr. Gomanek is going to be. So it's very thought-provoking, and it's going to speak to the hearts of people. A lot of what she has to say are not things that you want to really think about or talk about, but once you do, it feels pretty good when you do.
And so I just want to share with everybody how our Collaboration Cures mission has grown, and all the different groups and organizations who are coming on board to be part of our mission, which is Collaboration Cures will produce the most optimal outcomes. And we're going to skip this because we want to go right to learning opportunities, AAP MD library. We have something like 70 recordings. 71, including at least one by Dr. Gomanek in our library. Mm-hmm. And if you listen to what she has to say tonight, you listen to the old one, you can see how much new information she has. And so if you're an AAPMD member, they're all free at any time. If not, it's $35 per session. And then ACAM is now going to be doing weekly webinars. And they also have a great coronavirus resource center on their homepage, which a lot of it comes from Dr. Hershowitz. And they also have a lot of the latest news. And one of the latest news is our conference, our joint ACAM AAPMD conference, is still on for Seattle in November, and we're going to stream it. So it'll either be streamed if we get canceled, or a blended conference where it'll be live and streamed. But I think that if you can get there, we want you to get there. So let's go and introduce. I'll let you have the honors. Introduce our guest speaker for tonight as soon as I get to her.
There we go.
Go ahead.
So Dr. Gomanek grew up and attended college in California and moved to Houston for medical school at Baylor. And she received her MD in 1983. Neurology residency was done in Harvard, affiliated Massachusetts General in Boston, where she practiced neurology in the Bay Area from 1991 to 2004, and then moved to Tyler, Texas, where she lives currently. In 2004, she began to dedicate more of her practice to the treatment of sleep and sleep disorders. In 2012 and 2016, she published 2 pivotal articles, which we will try and get you links for. And go in her registry. You can look them up. You can't miss reading them. And she really understands the global relationship of vitamin D deficiency, intestinal microbiome. And then in 2016, she retired from clinical practice and developed this Right Sleep program. She currently teaches Right Sleep program and coaches with clinicians, physicians, doctors, and dentists in teaching you how to do this kind of Right Sleep program so you can help your patients. So without much ado, Dr. Gomanek, take it away.
Hi, thanks so much for inviting me again. I'm thrilled to be here, and I just want to make a preliminary statement that everything we talk about today is meant to be in addition to what you as a clinician already know about sleep and airway. So I occasionally have people come away from my lecture saying, she doesn't think it's about a drop in oxygen. No, I really think that drops in oxygen are important. I just don't think that's the only thing that's important. So everything we're going to talk about today is brain neurochemistry, and it's in addition. Learning this is in addition to what you already know about the anatomy of the airway and the treatment protocols that you've designed as a dentist or as an MD.
So it was your desire to start this off as a bit of an interview, right?
Yes.
So let's go to the 2 news items that came up recently. Low vitamin D can cause more severe symptoms, and too much vitamin D is of no benefit and may make it worse. Which one of those are correct?
Both are correct. So one of the This is not an exciting time for anyone, but it is a valid opening for a lot of my ideas. So lay people and physicians are now seeing vitamin D as a very important chemical for our immune system. And so the first part, which is, gee, when your vitamin D is higher, you're less likely to die of the COVID illness. That is true. The second piece is, if you just take large doses of vitamin D, you can hurt yourself. That's also true. So the reason why I have a website is I had several years of experience trying to learn how to safely and correctly use vitamin D to make people sleep better. And there was an actual endpoint, where the patient could tell me, I feel better. That's not the way we've thought about vitamin D. Because we now have a public statement that vitamin D is very important for the immune system, that gives us a really important opening to be more curious about vitamin D, to learn about how to use vitamin D safely, and to understand that vitamin D's major effect, in my view, is not just on our body, but on the fact that it supports the microbiome. So it's my belief that nobody gets sick just from vitamin D deficiency. They get sick because their vitamin D is low and their microbiome is wrong. Because vitamin D is a growth factor that supports the normal human healthy microbiome, and that microbiome is pivotal in both normal immunity and not getting an autoimmune disease.
Things have changed a lot since I went to school, and vitamin D was, they would put vitamin D in milk because it helped build strong bones.
How, you know what's discouraging is it's changed a little bit, but frankly, there were still people who are standing on the podium at the vitamin D workshop this last March, almost more than a year ago, who were thinking of it in exactly the same way as when we were in school in the 80s. So this is an extremely difficult and very odd place for medicine. So there are huge advances in the genetics, but the actual practice of medicine, the use of this chemical in the office is still in the 1950s.
That's very exciting. So why don't you go through your presentation, and we'll see what questions come up from our audience, because I have more questions to ask you. So let's go through your presentation, and then we'll come back and we'll chat further. Okay.
All right, Jordan, I want to just have my face up first, not the slides. So to start with, you can just put my face up and not this. There we go. So what we'll start with is a story. And this is a story of vitamin D from the point of view of our planet. And those of you who are gunners who want to get to the final endpoint, the biochemistry, which is where I live, let's take a couple of deep breaths, relax, and listen to the story. Because this is a way to understand how we misunderstood vitamin D. And this is the way we get to where we need to end up, which is, how is vitamin D related to our immune system? And we begin to understand just how incredibly big, how important vitamin D is. So the beginning is actually with bacteria. Bacteria came first, billions of years ago. Bacteria, those little things, they reproduce themselves by just making two of them. Those little bacteria have been here for billions of years. They don't have two sexes. They just have one. And then next comes fungus. And fungus also doesn't have two sexes, but it makes spores. And fungus is the first being on the planet that makes vitamin D. This is before chlorophyll. Okay, vitamin D is a chemical that's on the surface of the fungus. It's made by sun hitting it, and it helps the fungus grow. Now, fungus don't have bones. So already vitamin D is here literally millions and millions of years ago on fungus. The fungus is making this chemical from a fatty substance on its surface. Then the next thing that happens is flowering plants. First plants come, chlorophyll comes, so we have plants using the sun's energy through chlorophyll to grow as a source of energy. And as we move to flowering plants, green flowering plants actually not only have chlorophyll, but they have vitamin D3. So D2 is what fungus makes millions and millions and millions of years ago. D3 occurs with flowering plants. D3 is what every single animal on this planet uses. Insects, birds, fish, mammals, every single animal, including us, uses D3. And the only use of D2 on this planet is still from fungus. Except, even though none of those animals make D3, our American Academy of Family Practice still recommends that we give D2. It's the same stuff that yeast made millions and millions of years ago. Historically, a very old, we're giving that to our patients in a pill in a huge dose that's never found in biology once a week. That's still the current recommendation. So that is a snapshot of how bizarre our current recommendations are regarding vitamin D. They are completely out of sync with what we know about it. So go back to flowering plants, and here's why. Somewhere along the way, we decided to have two sexes. Bacteria don't have two sexes. And when you think about it, why would we need two sexes? It's a lot of trouble. What if she won't accept my sperm packet? What if she won't accept me with my dancing, with my little funny bird red shoulders? There's lots of mating behavior. There's lots of finding the opposite sex. Bacteria didn't need to do that. Yet multicelled organisms, once they develop, began to develop two sexes. So in plants, you may still have two different sexes on the same tree, but there's still pollination going on. So there's a basic concept, which is there's something really good about having two sexes. But as soon as you have two sexes, you have to kind of coordinate when you're going to pass out your pollen. Because one, what if it's snowing and I can't blow my pollen out to my flower that's supposed to accept the pollen? What if there are no insects to help pollinate me? So one of the things that started to develop as we got to flowering plants, way before even animals, was a hormone that affects fertility, metabolism, and behavior. This is even before animals came along, that's connected to the sun. So you can think of it as, gee, plants are connected to the sun through chlorophyll, but we're connected to the sun through vitamin D. And vitamin D is a trophic factor. It's a growth factor. It was a growth factor for fungus way before it came to being in plants and then in animals. It is trophic to most cells in the body. It is also a hormone, and it is the most important hormone that we've kind of misrecognized as a vitamin. It's a hormone that runs all other hormones, so that you can actually coordinate reproduction, what you're doing with your metabolism, what you can do with your sleep, so that you can hibernate. That means you want to have your babies. Uh-oh, I have my babies in the northern hemisphere in November. There's 6 foot of snow. That could be a big problem. Or it could be a big advantage. If I'm a bear and I dig a burrow and I have my babies under the snow, nobody can get at them. But in order to do that, one, I lay in one place, sleeping for months, feeding my babies. I'm hibernating. Hibernating or migrating are both run by vitamin D. So step back for a moment and think, why are we saying this is a bone vitamin? It was somewhat by accident that we stumbled into vitamin D as an answer for rickets. But that is one itty-bitty part of vitamin D. We happen to discover it in rats that are nocturnal animals. Nocturnal animals, in order to be able to live at night and not go out in the sun, must be able to use that really, really old chemical, the D2, that comes on the fungus that grows on the grain. So when we made our first mistake in the 1940s, saying that vitamin D2 was the anti-rickettic factor, then we lost contact with this bigger whole. And it's really since the early 2000s that people have looked back and documented that D3 is actually present since flowering plants. So with that as a context, humans tend to want to simplify things. We find something out and then we feel like we really know everything. I personally do not consider myself a vitamin D expert, and frankly, I do not think there is a single vitamin D expert on our planet, because there is so much to know and we recognize so little about it. So one, when you approach this chemical, it's a hormone that tells you a lot about how you should research it and how you should treat it when you're giving it to patients. You should always do levels. You should have great respect for it. Every single hormone wants a little tiny, tight, little narrow homeostatic band that it likes to stay in. But then you can start researching vitamin D and find out it affects everything in our body. There are hundreds of places in our body that vitamin D has direct effects. Today, we're going to talk about the immune system as one of the primary places that it affects us. And just to give you a preamble for that, the immune system is something that's very complicated, multi-layered. It has hormonal pieces, it has cellular pieces. That immune system is affected in many different ways by the vitamin D directly. But also, we have to think about the fact that the reason why we're collaborating here is to get people to sleep better, because we all know that healing is about sleep, that we are basically self-assembling, self-healing living beings. And if we sleep well every night, we get the maximum effect of every trophic, every healing process that we find in a petri dish or in an animal model. So vitamin D by itself directly has amazing effects on the immune system, shown in multiple different ways in basic bench research. But to get the best out of it, you really have to focus on vitamin D, its effects in neurotransmitters, which we're not going to talk as much about today. But if you look at my original set of lectures at the AAPMD, you can find out about that. Vitamin D is directly responsible for several things that we do in sleep. We're going to circle around to that at the end. So vitamin D's best effect is through improving sleep. So there's a tight little narrow band where D is better for sleep. And in my view, that means that's its pinnacle of use, is in that 60 to 80 nanograms per mil. So the next part is going to be, I'm not going to give you a lot of lectures about vitamin D in COVID or vitamin D in the coronavirus, because there are lots of lecturers who are talking about that. I want to stop at the end of that introduction and see if Pat or Howie have any questions about that piece. And then we're going to move into the next piece, which is an introduction into acetylcholine and why acetylcholine is so important for you to know about in regards to our immune system and COVID illness. Any questions from it? Either.
So, Sasha, I remember you once talked about how bears survive hibernation and how they make their own vitamins during that period of time. So, can you talk briefly about that?
Thank you, Howie. So the most important thing that I stumbled on by accident was the fact that vitamin D is a major trophic factor to the 4 phyla that make up the normal microbiome. So we've been told that we lost our microbiome because of toxins and because of antibiotics. I personally do not believe that. I believe we're now showing scientific evidence that shows that vitamin D is a trophic factor to the 4 normal species that are supposed to live inside us. That's historically pretty obvious in that we were a population of humans on this planet who had basically a normal microbiome, no IBS, no food sensitivities, no peanut allergies, no IBS, no sleep apnea. Those things have all started to become epidemic and have increased in incidence since the early to mid 80s. At the same time that vitamin D has started going down. So if you look at the parallels, there is a parallel rise in IBS and losing the microbiome as the vitamin D went down with those sun avoidance. So sunscreen, moving indoors, being told that being in the sun is dangerous for you, has led to an epidemic of low D, but then also a more important and more dangerous epidemic of the wrong microbiome. We're now starting to get articles, basic science articles, that show that when you change the vitamin D supply, these were done in mice, change the vitamin D supply to the mice, you can see that their actual distribution of which species are different in their microbiome. And one of the most important articles that just came out last year was when there's a change in the species representation across the microbiome, some of the species that go low when the D is too low are the ones that make the raw materials that help us make endocannabinoids. So they showed that the endocannabinoid system became deranged through the microbiome supply of the raw materials. Then they tested the pain sensitivity of the mice and the spinal cord. So their central nervous system, endocannabinoid system, becomes deranged. So Howie's question is about the B vitamins. It turns out there are an array of things that our microbiome does for us. One, it makes the raw materials that makes the endocannabinoid system. Two, it turns out that the microbiome that we have that's natural to our species makes 8 B vitamins. That was known in history, but has been forgotten, that the B vitamins are really always come as an 8-pack. They are made as an 8-pack, and the original description of those B vitamins, if you step back for a minute and say, well, vitamin A was described, and then we have 8 chemicals that are called B. Like, what's up with that? And then comes C and D. Why didn't they call them B, C, D? You know, why are there 8? Well, they're 8 because they were all discovered in a culture of yeast and bacteria that came from the air and the water. And it's the same culture that we use to make beer and bread. And you just sit it on the counter, make sure it's at the right temperature, and you let things grow for a while. And what you'll find in there is D2 that's being made by the yeast that helps the bacteria grow. And these phyla of bacteria are making 8 B vitamins, and they make them in a specific ratio to one another. That grouping, remember back to the history I told you, the bacteria were here first and then the yeast came. Those guys have been hanging out together for millions of years before we came. So the fact that we cannot make these 8 chemicals that we called B vitamins is because we had poop inside us that made them for us. So our biology was actually formed around the ratio of these 8 chemicals that are naturally made by the normal microbiome. So the first thing to think of is, well, gee, aren't we told that the B vitamins are water soluble and you can never hurt anybody with them and we just take them and pee out the excess? Well, that is the current dogma, but it's incorrect. That's probably true for B12, but it turns out there are multiple other articles that show we have stores, body stores of thiamine, B5, B6, and that when you use the bear as an example, the bear climbs in her den with her cubs and actually is able to breastfeed those babies and doesn't eat for several months. And there are articles that show that her colonic bacteria and really her small intestinal bacteria are feeding on the colonic mucus that she makes. And those bacteria are making her B vitamins. Clearly, if she doesn't eat, then the B vitamins have to come from somewhere. So hibernation is a matter of degree. We do bring down our metabolic level. And the way we do that is by lowering the thyroid hormone. So our bodies were set up to sleep or get to a sleep-like state for long spans of time. And we still had the production of the 8 B vitamins that we need for every single cell. Every single process we do in our body is related to the B vitamins. Sleep and the immune system are absolutely fixed to these B vitamins and their sources.
So if we're moving towards looking at acetylcholine and the importance of that, especially with what we're currently talking about, can you explain how acetylcholine receptor agonists have been shown to improve outcome in patients with severe acute respiratory distress syndrome, you know, beyond the neuromuscular blockade?
Great question. I'm not sure I can, but I'll come around to that at the end. Let me say this as an introduction. As a neurologist, when I read through the book that my patient gave me about pantothenic acid, And then it led me, so what happened in my practice was I was doing vitamin D. Vitamin D was successful in making the sleep better, and then we all kind of failed. Now we're sleeping badly and we have pain. Somebody walked in with a book about pantothenic acid. I was not the least bit interested nor knowledgeable. And then over a series of weird events, it turns out that pantothenic acid is pivotal for sleep. I didn't know why at the time because that wasn't really written about, but it turns out that pantothenic acid, which is one of the B vitamins, it's B5, makes acetylcholine. So because we were all desperate, we took B100, which is a large dose, 100 milligrams, 100 micrograms of each of the Bs, all 8 Bs together. And after some missteps, we found out that larger doses of B5 in the certain circumstances, like when your D is good and you take a lot of B5, you can get very agitated and not sleep at all within hours of taking it. On the other hand, if you get the dose just right, you'll sleep like a baby. Now, your question is actually about acetylcholine. So it turns out that B5 becomes coenzyme A, which then becomes one of the contributing factors to making acetylcholine. So over the last 8 years, I have struggled with how is it that patients can tell the difference, can either get insomnia or sleep beautifully with a single chemical, a single B vitamin with moves of 5 milligrams. And there's a lot to that, and that's what the Right Sleep program is actually about. Ultimately, the most important part of that right now for any of us is how does having the right physical makeup, how is it that some healthy people are able to fight off the coronavirus and other people are not? And it turns out to be not just about the immune system. So there's a single level, which is, oh, I can fight against this virus coming inside me. But there are actually multiple levels within the body where acetylcholine is going to play a role. And it turns out that some of the places that acetyl plays a role are probably in the lung. So that's a long answer to say I really don't know what the actual answer to your question is, because acetylcholine is used in so many ways around the body. And the reason why we're going to talk about it is it's now being thought of by some authors as being somewhat more like a hormone than it is like a neurotransmitter. So every single time we delve deeper into something, we find out, oh, there's acetylcholine flooding the whole brain, and it's being used by astrocytes and oligodendrocytes. It's actually being released in the bloodstream. It's actually being released as a chemical from lymphocytes. So it's being used in multiple ways, and not just in the traditional ways that we were taught, where a neuron releases acetylcholine at a synapse. There's probably a level of complexity where the synaptic use that we were taught, and if we can use the vagus nerve as an example, I'm going to show you some slides that explain this a little bit more, but we're now talking about the neuroinflammatory effects of acetylcholine, linking the vagus nerve, linking the nervous system directly. Not only does the vagus nerve link to the microbiome, but it also links to the spleen, and it has a way of messaging the immune system using its hormonal action of acetylcholine.
So would acetylcholine act as more of a predominant in acute respiratory distress, as a more of a predominant parasympathetic neurotransmitter in the airways as it regulates bronchoconstriction and mucus secretion?
Why don't I suggest that you hold that question for a minute, because I really don't know the answer to it, but it's a fabulous question. Why don't we go through why we're talking about acetylcholine so the rest of the audience will be able to connect the dots. So Jordan, is that okay with you, Pat?
Yeah. Jordan, you want to put the slides up?
Okay, so here's what we're going to do. We're going to talk about why I'm here, why I'm telling you about vitamin D. So this is a very brief, and you can see this in detail on the other lectures. I have 2 other lectures to the AAPMD, and I have multiple other webinars. So vitamin D is important. It's splashed across the New York Times and multiple other layman's papers now, which introduces it then to your patients, and somebody's saying you might not get the COVID illness, or you might get the illness and not be as sick if you take vitamin D. That means it's right at the top of our consciousness now. Now, the important thing is, back in 2012, Walter Stump and I published the first article that suggested that the epidemic of many sleep disorders, not just sleep apnea, but insomnia, was related to vitamin D deficiency. The most important piece, I think, is that the vitamin D is a trophic factor for the proper support of the microbiome, that it is really the vitamin D level that's being passed down to those bacteria that determines that we have the proper 4 species, and that those 4 species make the B vitamins, and that those B vitamins, at least 4 of them, play a large role in sleep. So thiamine makes dopamine and acetylcholine. B5 is pivotal for making acetylcholine. We're going to talk about that in a minute. B6 plays a role in making dopamine. So all of the B vitamins, B12 is very important for sleep. So you have to have the right microbiome to produce the right B vitamins in order to sleep normally. Now, the next part is, okay, what does this have to do with the immune system? Well, it turns out that the immune system is right in the middle of this. So there are now thousands of articles talking about how vitamin D, in the various ways that it affects the immune system at the gut level, as well as throughout the brain and the general immune system throughout the bloodstream. There are articles that are now showing us that the microbiome is extremely important in establishing what we think is an antigen, what isn't, where we interact with the bacteria, where we're interacting at the GI sites with the bacteria has a way of establishing what we're going to be seeing as a foreign invader and things that we're going to tolerate. The B vitamins are directly involved in multiple systems in building the immune system. And as I said in the preamble, I really think that sleep is one of the most important parts of getting the immune system to be healthy. So all of these then pieces that fit together are determinants of getting a healthy immune system. Now, here's the part I want to introduce to you. I can't give you the whole story because I don't know the whole story. I just want to introduce these ideas to you so that you'll read about this and recognize that this is part of what they're describing when they talk about this person doesn't really even have an illness and the next person dies rapidly. So there's multiple levels of, gee, it's not just catching an illness and getting sick. It's, did this person have an autoimmune reaction to that infection? And now the children that are being described with things that look somewhat like Kawasaki's disease are showing an autoimmune effect later after being exposed. So the next piece is to introduce you to some of the ideas and how acetylcholine plays out in the system. So vitamin D has vitamin D receptors all over the posterior part of the brain where we sleep from, the sleep switches. What does it make there? When it goes in and sits on the vitamin D receptor in the nucleus, it makes acetylcholine. And we're going to talk about the chemistry of that. This is the equation, and D, when it actually sits in its receptors in the sleep switches, makes this enzyme called cholinacetyltransferase. Cholinacetyltransferase is the last step in making acetylcholine. Pantothenic acid, one of the B vitamins, turns out to be pivotal. This is pantothenic acid. This makes up coenzyme A. And it turns out that coenzyme A doesn't get made if you don't have enough pantothenic acid. And it's my argument that our only source, our absolutely only source of pantothenic acid for our bodies is from the B5 that is secreted by our bacteria in our belly. So it becomes coenzyme A, and then the coenzyme A is the second piece that's needed to make acetylcholine. So here's the equation. B5 becomes acetyl-CoA, and D makes cholinacetyltransferase. That means that these two guys together add up to making acetylcholine. Now, what that suggests is that we're walking around for the last 40 years with an acetylcholine deficiency, which is a really weird idea. And I'm not going to try to convince you of that because it's not simple, because I still struggle with the idea, but here are the things that acetylcholine does. If you just type in acetylcholine and sleep, what you get are basic science textbooks that are mostly done in animal models that establish that Frontal acetylcholine levels at nicotinic receptors establish our ability to concentrate and our level of alertness during the day. And then a little switch flips at night, and acetylcholine actually runs our ability to transition through various stages of sleep and to get paralyzed. Well, could that mean that the parallel epidemic of ADHD is from this? Yeah, that's what it means. In fact, we have imaging procedures that show that kids with ADHD have acetylcholine deficiency. This is an older anatomic drawing of where acetylcholine is used to make us paralyzed. It's clearly not the only neurotransmitter. There are multiple neurotransmitters that are used for us to get paralyzed and for us to have normal phases of sleep. But it appears to me that the epidemic in the last 40 years came about with the loss of the microbiome, with the dual loss of both the D and the loss of the B5, leading to an acetylcholine deficiency that affects our sleep. So as Howie mentioned, our autonomic nervous system, which is beautifully measured by heart rate variability measurements. Now we have hundreds of articles that have documented heart rate variability abnormalities in multiple different diseases. The autonomic system is made up of two multiply inhibiting and very linked together. So they're constantly sensing each other. The fight-flight side and the rest and digest side, the parasympathetic as given in this rest. Rest during the day is really about not being anxious. Rest at night is about sleeping. The parasympathetic is the rest and digest side. Keep that in your mind, because what would it look like then without this side? So what prompted my interest in this is I started this whole voyage with 32-year-old women with daily headache who were sitting on my examining table. They were completely healthy. I knew what their sleep looked like at night. They had no REM or shortened REM, but they never had apnea. They didn't have drops in oxygen. And they were sitting on my examining table with a heart rate of 110. So I knew that there was something in the background that was affecting their parasympathetic system, but I couldn't pull in the explanation that we've been given about sleep apnea, that, oh, they have drops in oxygen and it starves them of sleep and that puts them in fight-flight. Well, if they don't have drops in oxygen, what if they just don't have REM? That kind of puts it back in the brain location. What's wrong with the autonomic nervous system? And eventually I began to think that, well, if they don't have the right microbiome, they don't have the right vitamin D, then none of these things are happening because they are actually in such high sympathetic tone. So instead of thinking of this high sympathetic tone as being in relationship to the stress around us, or in the drops in oxygen in the equation that we put together for someone with sleep apnea, what if we think about it as acetylcholine deficiency? I'm not saying this is the answer to everything. I'm just saying maybe we should consider thinking about it that way. What would that look like? Is there any supporting literature to suggest that that might be the case? So these are some of the recent articles. Acetylcholine, neuromodulation in normal and abnormal learning and memory, vigilance control during waking, sleep, autism, amnesia, and Alzheimer's disease. Acetylcholine is the center of Alzheimer's disease. It turns out it's also one of the central observations about autism. It is also in the center of sleep. It's in the center of Parkinson's disease. So we're actually starting to use nicotinic patches or nicotine patches in autistic kids. Mood and anxiety regulation by nicotinic acetylcholine receptors are potential pathways to modulate aggression and related behavioral states. This group is using nicotine patches in autism and showing that kids' behavior gets modulated. I personally would like to see them do things, similar things, but with a microbiome that's normal. It's my belief that you can actually reverse autism by bringing the right hormonal and neurotransmitter actions of acetylcholine back. Cholinergic dysfunction in Parkinson's disease. It turns out that the cholinergic dysfunction happens 20 years before the dopamine starts to go low. We have now beautiful imaging procedures that documents that. Now we're coming right back around to Pat's question, and another really interesting area that I'm just starting to understand and really have just started to dabble in, and that is the cholinergic anti-inflammatory pathway. This is described in 2003, and I'm just going to read you what the summary is, because it kind of does the best job. Cholinergic anti-inflammatory pathway, a missing link in neuroimmunomodulation. This review, now remember, this is 2003, so this is a long time ago now. This review outlines the mechanisms underlying the interaction between the nervous and immune systems of the host in response to an immune challenge. The main focus is the cholinergic anti-inflammatory pathway, which we recently described as a novel function of the efferent vagus nerve. This pathway plays a critical role in controlling the inflammatory response through interaction with peripheral alpha-7 subunit containing nicotinic acetylcholine receptors expressed on macrophages. We describe the modulation of systemic and local inflammation by cholinergic anti-inflammatory pathway and its function as an interface between the brain and immune system. This suggests, this is one of the very beginnings, I put these guys up here because they started this idea. This is the very beginning of saying acetylcholine actually kind of acts like a hormone and lowers the inflammation in a general sense. This is a really interesting article, and it's an older one too. It's 2013. Regulated extracellular choline acetyltransferase. Now, this is talking about the fact that there is the enzyme that makes acetylcholine is not even, doesn't even have to be in neurons. So regulated extracellular choline acetyltransferase activity, the plausible missing link of distant action of acetylcholine in the cholinergic anti-inflammatory pathway. This is a more in-depth, this article is a much more in-depth discussion of how it is that acetylcholine acts on various parts of the cells of the immune system and acts kind of like a hormone, a blood-borne transferring message that actually starts in the vagus, goes to the spleen, and then can be transmitted through the blood. So then we put this slide up again that actually describes that, gee, all of these things that we said were attached to each other are also actually attached to what our acetylcholine levels are. So I'm gonna have you take the slides down now. We'll put them back up in a minute, but now I'd like to see all three of us. Jordan, if you can do that. There you go. And Pat, I'd like to answer your question. Here's my answer. I don't know. That's very complicated and it's over my head, but I bet that what we're going to find over time is some of the differences that we've seen in how people respond. So the things that we have already, if you have dark skin, you're more likely to die of COVID. If you're fat, you're more likely to die of COVID. If you happen to live in the Southern Hemisphere and the coronavirus happened to come to your country at the end of your summer, you might actually have a better outcome. There are now articles that are showing that if you happen to have very dark skin and you live in southern India, you may actually, if you're really, really, really poor and you still live outside because you don't have a place to live, you may actually have a better outcome than the wealthier, higher socioeconomic, similarly dark-skinned software engineers that actually live in town. So some of those ideas were in the background in my head when the COVID virus arrived. I thought, I don't know if this is D-related, but if it is, these are the things we should see, and that's what we started to see. The next thing that you'd expect to see would be if your vitamin D was low and you're a kid and you have not the same acute infection, but your microbiome is bad and your D is low, you may manifest in response to that viral infection an autoimmune disease. That's one of the things that we've seen in the background over the same 40-year span is a dramatic increase in autoimmune diseases, especially in children. So some of your questions, in fact, what I'll do is invite you to say what you know about that, because I don't really know. Tell us about the lungs and the acetylcholine agonists and that sort of thing.
Unmute yourself, Pat.
Sorry about that. We all know that Cubby likes to come to these meetings, so we kind of have a problem with Cubby wanting
we have our own webinar dog.
Yeah. So I think what I'm trying to understand is if acetylcholine is synthesized by non-neuronal cells and tissues, including inflammatory cells and structural cells. I'm trying to understand what's the regulatory role of it in inflammation and remodeling. That's kind of what I'm trying to understand. And so does it help to modulate inflammation and remodeling with respiratory disease, especially acute respiratory disease? And I mean, we see it in asthma, for instance. So that's kind of where somebody sent me off in the weeds, kind of talking about that. And so how do we make that distinction? So I'm probably standing way out in the weeds.
No, that's a great question. I don't know the answer to it. I'm just starting to read these articles. Frankly, the article that was just sent to me by a client, not by a doctor, the article that was just sent to me was actually from this same group out of the Karolinska Institute that was about proton pump inhibitors permanently disable choline acetyltransferase. That group had so many things about the importance of choline acetyltransferase that I was just like, this is amazing. These guys turn out to have written all of these really important articles about how does where does it come from? What's it doing in the extracellular space? Why is it there in the bloodstream? Who makes it? How do they make it? So this one group at the Karolinska Institute has done a lot of that work. It appears just in the last 2 weeks that I've been reading those articles that they're starting to say that it acts not like a neurotransmitter, but it acts more like a hormone.
More the hormone.
Yeah, that it's actually on the basic cellular basis, that it has multiple levels, like we're learning about D, that it's not as simple as saying, is it a vitamin or a hormone? Is it a neurotransmitter or a hormone? It actually can have,
characteristics of both.
One. So it can have characteristics of either. And looking at it that way explains so many of the weird things that have happened to my clients over time that I got really excited about that, because there are phases at which you give someone vitamin D, and if you do not bring back the microbiome, and here's the final message for everyone listening here. If you start to learn about D, if you start to take D, if your patients start to take D, you must do the second piece, which is to bring back the microbiome. And that is not with probiotics. If probiotics worked, there would be no industry, because you would take it 1 month and then you'd be fixed for the rest of your life. Because the natural state of the microbiome was always, it originally shows up spontaneously in a 3-month-old and an outside living mom, because the mom is making D and passing D in her breast milk, and it is the D that's the growth factor that coaxes the right phyla to grow. That means if you have the right vitamin D, all of a sudden you're starting to sleep better, you're starting to make more repairs, it's increasing the amount of repairs the body is making. But if your microbiome is bad, you will not be able to supply the Bs to match. The way you do get the microbiome to come back is to replicate what that original symbiotic group that I described in the yeast, which is give a combination of D plus B50, which is all 8 Bs in large dose. Then you bring the microbiome back. It is my belief that the microbiome coming back is what protects us from having these dramatic responses to the virus. It lowers our incidence of autoimmune disease. It brings our immune system back to normal. So anyone who started D needs to do the process that brings their microbiome back. And that actually involves learning about the B vitamins and learning a little bit about how acetylcholine, too much and too little, both present. Because once you start to add D, you will actually start to have times when you used up the B5 stores, and then people start to have increased anxiety, burning in their hands and feet, palpitations, atrial fibrillation. It's actually secondary to taking vitamin D. It's not an effect directly of vitamin D. It is vitamin D inducing more repair and using more vitamin D pulls out all the vitamin D stores out of the body, and then you start to manifest B vitamin deficiency states.
So, Sasha, do you have any more slides you want to show tonight?
Just one that advertises my website.
Okay, so before we do that, you know, I'm a big, we use a lot of heart rate variability in our practice, and acetylcholine is really thought of as a parasympathetic neurotransmitter. It slows the heart rate, and adrenaline and sympathetic raise the heart rate, and you're measuring heart rate variability by those shifts between the different influences on their heart. And as you shift from parasympathetic to sympathetic, you increase the upregulated immune response, and there's going to be more inflammation. And sort of that, and what you talked about tonight so clearly, and the cytokine storm that is wreaking havoc with COVID. But in reality, every single chronic disease is the same process, only in slower motion. And if nothing else, this COVID pandemic should teach us, we have to get our act together, because whether we pay the price and we die right away, or we pay the price and we die slowly. And you know, the other thing that acetylcholine is very important for is memory, and that may play a role in decades of an imbalance leading to cognitive loss and Alzheimer's. And the other thing I wanted to add is that we take vitamin D levels on every single one of our dental patients who either have a periodontal gum problem, or excess decay, or sleep problem. And invariably, it's always low. And sometimes it's really frightfully low. The other thing, which I might ask you to explain, is that some people with low vitamin D actually have chronic body pain, almost like fibromyalgia. You know, it's sort of like osteomalacia type of thing, where you just have deep bone pain. So my question is, we take vitamin D levels, we're going to be more health-oriented dentists, and then we have patients supplemented. But you have two things one thing you didn't mention is you need to constantly monitor the vitamin D levels to know when, and you're a big proponent. There should be a way that people can do that at home, like almost on a weekly basis. So could you just briefly talk about the way you would like vitamin D to be measured?
I'd be happy to do that. First, the good thing, in most of the United States now, you can actually get your vitamin D level done yourself without a doctor's order. So a layperson can order a vitamin D level through a site that's called Ulta Wellness, and you can find that on my website, but it's ultawellness.com. It's associated with Quest. It is $39 to get your vitamin D level done. If you're supplementing vitamin D, you need to know that the D testing needs to be light chromatography mass spectroscopy. That's called LCMS. If you're actually going to try to use vitamin D to make your health better, then you need to have a vitamin D level that is accurate. And there has been a huge rash of tests that are done by immunoassay that are not accurate above a level of 40 nanograms per mil. So you have to be careful with what you order. Unfortunately, in New York State, Rhode Island, and New Jersey, those state governments will not allow lay people to get their own lab tests, which is unfortunate. So you have to either cross the state border or get a doctor to be interested in the test you want to do. There is another option, which is to do it by blood spot testing, which means you put a drop of blood on a piece of paper. There are several labs in our country that will do that, some directly as a lay person ordering online, and some through physicians. And those are LCMS technique as well. The vitamin D, when you're adjusting your dosing, should be tested every month. Anytime you change your vitamin D dosing, you should test again within a month. Anytime you're using vitamin D and being out in the sun, so if you have a summer where you're spending time out in the sun, which I really encourage you to do, You should be testing your vitamin D to see what the proper dose is with a combination of two sources, the sun source that you're making on your skin and the source that you're taking orally. And that'll mean you'll have a different winter dose than you will a summer dose. Also, every single human being has a different dose of vitamin D. There is no predicting what dose of vitamin D anyone needs. You must start with a vitamin D level, then take a dose, and then do a D level again in 1 month. So there are many vitamin D experts. We all have our own opinion on what the right D level, the blood level, should be, and that depends on what you're trying to accomplish. So if you want healthy bones, you might think that a level of 40 would be right. If you want to get pregnant, you have a different level. If you want to have the best sleep, and in my view, the best health possible, then that right level is 60 to 80. But that's a blood level. That's not the dose. So the dose has to be investigated with every single person. And until you actually have data, you don't really know where your vitamin D level is. And therefore, you won't be able to attach, do I feel better or do I feel worse, to what your vitamin D blood level is. It's a bit complicated, but the outcome, the actual healthy options you have, or the outcomes that you're going to have as you understand how to do this, is phenomenal. It's really the core of our biology and how we stay healthy instead of winding up with medical problems. So
one of our other physicians who's on the webinar tonight wants you to see, can you make a distinction between REM and non-REM sleep and acetylcholine? Because he's saying acetylcholine is active in REM sleep, but not in non-REM. However, non-REM sleep, when growth hormone is at its highest, is probably involved with immune system restoration. So how can you make it more clear how acetylcholine helps the immune system via changes in the sleep itself? Great question. In actual fact, I think acetylcholine is probably involved in all of our transitions into different phases. So it's my view, this is only my personal view, that each one of the transitions we make, so that drowsiness has a specific chemical footprint and its ratios. There are multiple neurotransmitters there, not just melatonin, acetylcholine, dopamine, glycine, GABA, serotonin. There are multiple neurotransmitters, and each state is determined by which are high and which are low, and within different cells. So it would be my supposition that acetylcholine and acetylcholine levels are also involved in deep sleep. Mm-hmm. So, but I don't know that as a fact. I don't really know that anybody's actually tested that. There might be a good literature on that. Now, the next piece is growth hormone absolutely is going to play a role in this. And there are other things to know. For instance, the patients that I published were, in the main, young, healthy females who had lower amounts of REM, but most of those people had pretty normal deep sleep. There is a separate body of literature about vitamin A as an apple being directly involved in being able to make deep sleep. So if I were to ask you to take away something, it would be that the chemistry of our sleep, our ability to transition through phases and spend the right amount of time in phases and get paralyzed correctly, are related to multiple different vitamins, not just D, but A, our microbiome, and the Bs. All the vitamins play a role in our healthy sleep. And therefore, the most important thing is to try to bring our biochemistry back to its homeostatic middle where it was supposed to be. Each person who has a sleep disorder, actually, even if we all fail from the same epidemic. So if I'm making an argument that 40 years ago we started sunscreen and went inside, and we all failed from the same deficiency state, we all manifest our unique genetic footprints after that. So even when I give back a starter pack for every single patient, each person has their own unique way of manifesting that. Some of us have insomnia, some have restless legs, some never have a sleep disorder, we just have headaches during the day. So each person is unique, and I think what I'd like most is to open up our minds about using
what we know about vitamins as a way to intervene along with mouthpieces, CPAP, sleeping pills. And we add that to the multiple forms of treatment that we use. And I think right now with my clients, most of them have sleep trackers. So they're teaching me all sorts of things, and we're trying all sorts of new things. We are in a new age where we're going to have whole thousands of people who are donating their data from their Oura rings and their Fitbits, and we can actually do sleep studies at home by intervening with vitamin A or vitamin D or B5 doses. That's what exists in the future. I want to open that as an idea for everyone who's interested in sleep.
That's great. So
Amazing. Thank you so much.
I would love for you to give a day or 2 days to an audience of multiple practitioners and seeing how each of us can work better together with other groups. And why don't you put your right sleep slide up, because
Okay.
we are really running over.
Hi, Kitty.
Hi,
Jordan,
Kitty.
can we put up my last slide? It was the one right after where you were.
There we
There you go. Okay, so my website is, and if you'll just move our pictures down.
Pictures out. Yeah, there we are.
This is the short answer. There is a recipe for bringing the microbiome back, but it's a little longer than that. In that really, you take a full year to get everything back in place again, sometimes longer, depending on how sick the person is. I have a workbook that walks you through every single challenge that's going to show up and what to do about it over time. And we're now working on a set of videos and a way to use this workbook for pregnant moms, for women who want to get pregnant, because vitamin D is directly the determinant of pregnancy, directly without any microbiome interaction, or probably any acetylcholine for that matter. So how to use this regimen, the right sleep regimen for fertility, for pregnancy, and for breastfeeding and first year with your baby. So your baby is happy and smiling, not crying all the time, and sleeping through. Same thing for children. We're about to put out a video series for children as well.
That's fantastic.
Really impressive. Thank you so much.
And you know,
Thanks for having me.
You're welcome.
every time I ever have a conversation with you, it goes on for hours.
I love talking to you, Howie. You're so smart. Both you and Pat are just brilliant people, so it's my pleasure. You always ask great questions.
That's great. So we want to thank you for taking the time to do this. It's wonderful. I love how you've expanded the information, which is great. Our next webinar is tomorrow night, right?
Tomorrow. Yep, we're on tomorrow.
Reopening readiness, what you need to know, and what pearls of what you can do better. And then next Tuesday is thank you, Jordan. That's great. The Nicole Archibald Besson and Linda D'Onofrio, myofunctional therapy, speech language pathology. And Wednesday, the Peerless leader of ACAM with a coronavirus
update. Yep.
What you need to do. He gave us a lot of information in the past, what you can do at home, because most offices weren't open. Now that integrated practices are reopening, it's a great time to think about making an appointment with an integrated physician and checking out your immune system. You want to fine tune immune system. You want to have the right immune system, just like you want the right amount of vitamin D. And I have a poll that I'm going to run if I can figure out how to do this. We'll do that and see if we can. And Pat, last words.
Just thank everybody for coming. We know you're getting back to work and you're busy and you've got lots of thoughts on your mind. Spending this time with us, getting a better education to help yourself and help your families and your patients. So we thank you for supporting the AAPMD and ACAM. That we'll be here for you and trying to keep moving things forward and taking care of our friends and family and our communities. So everybody, thank you, Dr. Dominic. Good to see you all. Have a great evening.
And don't shut this off, Jordan, because we're just getting our poll results in. And there are people who would like more information about ACAM and the APMD, and I encourage you to go to either site, get more information, join one, join both.
Join.
and join us.
Yes, you will be receiving an email following, most likely by at least the end of the week. It's going to have a recorded version of this. That's going to also have a lot more information about not only ACAM, but also APMD and upcoming opportunities. And so we look forward to not only hearing back from all the attendees, but also keeping up with our presenters.
And this great radio voice in the background is Jordan, who made this evening so easy.
Oh, this is so good.
We don't have to look at anything and monitor anything.
Yep. So good. I mean, we
So,
are
Jordan,
technical
thank you so much
turkeys.
for making
This is
everything
wonderful.
so smoothly.
Yeah.
Yes, sir. It's a pleasure to be able to work with you guys and not only glean valuable information, but just be a part of what's going on here and the future of medicine. That's what we're doing.
I'm going to have an opportunity again to do it next week. All
Yes,
right.
we are. Yes, we
Good night,
are.
everybody. Thank you.
Good night.
All right, guys. Have a great evening.
Thanks, Dasha. Take care.
All right. Bye-bye.